significant amount of pain or I feel like they will feel vulnerable in this position, I will test their internal external rotation in sitting at elbow 90 degrees with the towel underneath the elbow, and I'll resist internal and external rotation in that position. My preference is to do it at 90 degrees of abduction if they can tolerate it. And then the positioning, again, we were talking about yesterday with your positioning not having the elbow drop behind the body unless that's what you want to do. So if you move towards the right hand side of the head, here, elbows up here. That's probably throw it really high. There. So I just want it supported in a neutral position. The left hand, you hold on to the side of the bed. Now the protocol that I use is that we do a 50% effort, 75% effort and then 100%. They can have multiple goes at 100% if they're continuing to get stronger with that, but if they are, generally I will do one go at 100% and standardise it towards that. If they're building confidence, it's okay to keep going and getting another, doing another 100%, relative 100% effort. If they have pain, I want you to stop pushing completely. So we're looking at internal and external rotation of the shoulder in this position as a measure of rotator cuff strength. So I know it's not isolated, but it's something that we can give an objective measure and tends to use the muscles around the rotator cuff. Now, obviously internal rotation, we've also got lat dorsi, pec major contributing to that. So it will be the bigger muscle groups, and this is the one where if you're a smaller female, large man, fit, trained man, it can be difficult to hold that position. So I'll either try and do a fixed point assessment, or I'll get one of the bigger males in my practice to come in and do the power for me because I can't do it. So if I'm rehabbing someone from a shoulder instability and I want to clear them to go back to sport, and they are a 20-something year old male who's training, I struggle to hold them, and that's what it should be like. If I can overpower them, they are not strong enough. So in this position, don't feel the need to overpower me though, it's okay. It's all right. So left hand holding on, so unaffected side holding on, or you're doing both sides. Here you're going to be rotating down this way. It's an isometric test, you're not actually going to move. So we're going to do 50, 75, 100%. Each go is only a couple of 3 seconds each time. So it's not a sustained effort. We'll use the first one as a warm up and then the final one as your big effort. And then I've got the handheld dynamometer. You are going to be pushing into me, not me into you. Okay, so we do a 50%, so push into me, push, 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 relax, good. And that feels okay. And use the first one as a warm up to say, does it bring on any of your pain? And then 75%, go harder, push, 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 push. Wait, look after me. Now, with your 100%, if you feel comfortable towards the end, I'm going to try and push back on you. So that's an eccentric test. So you can have a make or a break test. If you go towards a break test, you want to make sure that the person feels comfortable, so there'll be no symptoms, and also that their tissue is structurally sound, so it's been long enough from a structural injury that you feel confident that you're not going to injure them doing it this way. If you have any concerns about that, you'll just stick with the protocol of you pushing to me. But in the end, I want to try and break you. So we're going to go 100. So push in, 100, push, 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 push. So you try and overpower. If you do a break test, you are likely to get higher numbers on a handheld dynamometer. External rotation, opposite, and the same protocol. So pushing back toward me, your 50 and your 75 and 100%. Now, as far as the information I get from that, objective numbers are very helpful, looking both at right equals left, and in most cases, people should be about the same. Maybe if someone is a pitcher or does a very unilateral, like a tennis player, sided sport, they might be 10% stronger. But essentially, they go to the gym, they work out, you work both shoulders, they should be pretty even right and left. Secondly, we want a ratio between internal and external rotation. So if we're looking at the internal, should be stronger, obviously bigger muscles, external, not as strong. So internal to external should be about 1.5 to 1.3. I think 1.3 is a really nice number as far as a ratio goes, and that's for everybody. So that can be something that can help guide you to say, okay, first of all, do they have enough strength? Now, it's difficult to find normative data about this. If you do a lot of work with people, you get a bit of a sense for the population that you're working with. For me, I like, from a healthy young male, I like about 200 back, 300 this way in newtons. For the girls, in a really strong trained individual, it might be more like 150 to 200 and 150 back. So 250, 150 sort of thing. So they should be able to push good enough in trained individuals, and it depends on their lever length, depends on their muscle size, their body type, and the sport that they do. But it gives you something to start to work towards, to say, okay, you've got enough strength but your balance is off, or actually you don't have enough strength. So for example, I work with a para athlete who's a discus thrower. She needs more front strength on her throwing arm. We've done her strength testing, we've looked at it previously. Her external rotation numbers are excellent. Internal, she's got scope within her muscle capacity to be stronger, and obviously with her movement that way, she needs these muscles. That's where her power comes from. So that's what we're working on at the moment, is starting to get a little bit more of that activity. So just go and practice that testing position, get a feel of doing a make and then a break test, and feel how much strength you can get through the shoulder. Now, be responsive to the person that you're working with. Don't overpower them excessively. Obviously, it can feel uncomfortable, so just pull out of that test, okay? If you're the person having your shoulder pushed and you don't like the feeling, verbalise it and stop pushing, okay? All right, off you go.